Clinical and Care Governance Committee. We've got a full room here today, which is really nice. It's great to see people in person. I'm Anne Hannah, just for anyone who doesn't know me, and I'm the chair of this meeting. And you'll probably be familiar, but I'll ask people if they could just introduce themselves as they go around. I think possibly most people know one another, but we have got one or two new faces, so everybody can introduce themselves as they're going around. So first of all, have we got any apologies?
Apologies from Margot.
Okay. And any declarations of interest? Okay. So next item would be item 3, the minute of the meeting from the 21st of June 2024, which would be in your papers. Is that a correct minute? Everyone comfortable that is that agreed? Yes, agreed. Does anyone have any matters they want to raise from that minute that are not on the agenda? Okay. In that case, we'll move on to the rolling action log. There's only one item on the rolling action log, and that was on the adverse deaths. There is a reference in a paper today on that, and there's a paper coming to the IJB. That's all clear, so there's nothing else we need to say about that. Okay, and then in that case, we will go on to item 5, the local oversight arrangements.
Okay, so yeah, I'll introduce this report. So this is the sort of standard report you get on local oversight arrangements. So in this particular report, you've got an update on the Falkirk Public Protection Chief Officers Group meeting. Their agendas are confidential, but they did at their meeting in June discuss the Forth Valley Child Interview Team, the Adult Protection Data Summary Report, the Public Protection Lead Officers Group update, and which has just newly been created. And there was a webinar on public protection across the lifespan on the 2nd of September, which was very well attended. There is a health and social care clinical and care governance management group, and as per the last meeting, there's now a specific report coming from that group to provide assurance to the committee on clinical care governance, and that's on the agenda, so I want to talk about that just now. There's an update in this report about NHS Forth Valley clinical and care governance arrangements, and that includes an update from the NHS Forth Valley Clinical and Care Governance Committee. And again, you can see what they've been discussing, the recent agenda, and the reports and updates that have been received, and that's under a number of headings in the usual manner. And there's also similar information relating to the Clinical Care Governance Working Group within NHS Forth Valley, and that group obviously feeds into the NHS Forth Valley Clinical and Care Governance Committee. In addition, there's an update on the Alcohol and Drugs Partnership. Again, I won't go into the detail in that, and there's quite a lot of information there around the MAT standards as well and their implementation. You'll note there's generally some green in terms of RAG status of the implementation of the MAT standards, and the ADPs in the process of considering how drugs deaths are reviewed and are establishing a new overdose prevention and drug death monitoring group as an ADP subgroup. There's a section on the Forth Valley Prevention Plan, which is ongoing at the moment in relation to suicide prevention and drug-related prevention. And there's an update on the Falkirk Adult Protection Committee that's taking place as well. And there's an update on care home assurance arrangements. That includes arrangements through the care home assurance review team, chart, and the social care chart team as well. And finally there's an update on the Health and Social Care Partnership Health and Safety Management Group. And again, there's information provided about the agenda items that have been covered at the meeting on the 30th of July. So across the people through the meeting, we're happy to take any questions and comments.
Okay, thank you very much, Gail. Does anyone have any questions or any comments to make? Roger?
Thanks, Chair. In section 9.9, it says all operational managers and their staff have received briefings on ASP National Minimum Data Set. I don't say that that's not accurate because I said we haven't emailed.
I think that relates to the performance team, staff in the performance team, because actually what's changed is the information report to.
Right, so it's just me not understand this to be clear. Not just operational staff, it's other specific staff.
Yeah,
Right,
yeah.
okay.
Probably should be that clearer, that update.
But could I ask, can people online hear? Because Martin's got a very soft voice here on my right. Are you able to hear all right?
Yeah, I can hear fine, thanks.
Okay, that's fine. Just wanted to check. Okay. Anybody else got any questions or comments? Are you happy with that, Roger?
Yeah, obviously.
Any other questions or comments? No. In that case, we will move on to, sorry, no, we will not. We have considered and commented on the content of the report, so that can be recorded, please. We'll move on to item 6 on the agenda, which is the Clinical and Care Governance Management Group. And I think that's going to be Nicola.
Yes, thank you. So the report you have provides committee members with an update from the Clinical and Care Governance Management Group. And as agreed at previous committee, a redesign of the management group has commenced with the development of 4 subgroups, which now report directly into the management group. So the 4 subgroups that has been developed are community-based services, bedded care services, locality services, and then other regulated services, so covering all aspects of partnership services. And primary care will share a report into the management group moving forward as well, so we'll have that rounded view. Reporting via the management group structure has now been standardised based on the Vincent framework, and that format covers as the following questions. So, is care safe today? Was care safe in the past? Will care be safe in the future? Is care person-centred? Are we learning and improving? And are our systems reliable? So as part of that agenda, the management group, when we met in August, considered a range of items on the agenda, and this included the following. So compliance with safe staffing legislation in all areas reported that they are compliant and have clear escalation processes. Results from any unannounced care assurance visits or indeed care inspectorate visits across all other services. And again, assurance was provided regarding the appropriate actions being undertaken following any of the visits. Safeguard reports submitted from all areas, including any emerging themes, any trends, any areas for improvement and opportunities for shared learning were also explored. Details of care inspectorate notifications submitted from the internal care home settings across Falkirk Health and Social Care Partnership were shared, including again any emerging themes, trends or opportunities for shared learning. Adverse events and significant adverse events were also explored, and timelines for reviews were agreed within the management group, and feedback will be shared in due course to the management group, again to allow that learning to be disseminated across the partnership area. Policy reviews and renewals were discussed, including the care at home medication policy as well as patient injury guidance, both of which are currently under review and due to be finalised soon. We also looked at the complaints, compliments and staff experience that were discussed as part of the agenda, again with opportunity just to highlight those themes and any opportunity for learning. And assurance was also provided from the subgroups that business continuity plans and risk registers were all relevant and reviewed regularly. We also discussed training and education for staff, particularly in relation to adverse events, fatal accident inquiries and mandatory training. And appropriate actions were identified to strengthen the compliance across our services. So in terms of future steps, the action period in between the last meeting and our next meeting we agreed that there would be ongoing work to consider the overlap between health and safety and clinical care governance work streams and develop a solution to really reduce the duplication of effort. We have also developed a Pan Forth Valley community-based adverse event review group in collaboration with colleagues from Clacks and Stirling, and that will allow relevant interrogation of adverse events and provide a refined process for escalation when required. And all of the subgroup members were asked to focus on providing their data over time, again, just to allow that further understanding of emerging themes and areas for celebration, as well as areas for improvement. So I suppose in conclusion, the first meeting of the refreshed format of the management group was successful and allowed for those really rich, meaningful discussions and joint planning to take place across the health and social care partnership areas, and the committee asked to consider and comment on them.
Okay, thank you very much, Nicola. Can I just ask, I was glad to hear you making mention of primary care. Can you maybe say a wee bit more about how that's going to be incorporated into this? Because I'm conscious that we have had primary care within the partnership for 1.5 years now. And from where I sit, I've not necessarily seen as many reports as I would have liked to. So I think it's quite important that we highlight how that's been integrated into the whole process.
Yeah, so I suppose to start off by saying that Dr. David Heron, the clinical lead for the partnership, is a key member of the management group as well, so he was present at that level. The primary care team, you might want to come in as well, but the primary care team also have their own governance meeting. It's called the Primary Care QIC, the Quality Improvement Group, that looks at a lot of the clinical and care governance aspects. And they are now going to be providing a formal report that will then come to the management group. So a lot of the work is happening already. It's just threading it through the new governance structure. So the information from the primary care QIC will now form part of this report that the committee will receive moving forward.
So do you really want to introduce yourself? Because you are quite new.
This feels like a wee while.
I know, I should have been saying that to everybody.
Right. I'm Tom Cowan. I'm the new interim head of primary care. I just arrived 3 or 4 weeks ago, so hello to those on screen as well. So I was just going to say, yes, it's an absolute valid question about how we find a way of assuring that the assurance that might be required is also fed into that forum, because of course globally we are responsible for the kind of safety of everything we do. The distinction, of course, is of course these are generally speaking or almost exclusively contracted individual businesses, and therefore the relationship is not as seamless as it may otherwise be with our own employed and directly managed services. But it is something myself and David have had conversations with, and Scott from NHS Forth Valley. So we're going to be working on that to make sure that from the IGB's perspective, that there is at least an acknowledgement of assurance being required that you can come to it.
I think that's important. The whole point of having the integration is to integrate.
Oh,
And I think it's important that we make sure that that's in there.
Yes, absolutely.
Okay, thank you. Does anyone else have any questions? Yeah, Roger.
Sorry, don't know the Vincent framework where you mentioned there. Would it be possible to get a sort of formal thing about what the Vincent framework is?
Yeah, absolutely. There's
around that.
a document that goes into detail around that. I can make sure it's shown around the group so you've got the background. Yeah.
That'd be great. It just always occurs to me when they say things like, is care safe today? Well, it's a relative term rather than absolute terms. Nothing is 100% safe. So it'd be useful to get an idea of how the Vincent framework is being used.
Yeah, absolutely. We can share a formal document with you.
Thanks.
Okay, thank you. Stephen?
Oops. Good morning, folks. Stephen McAllister, non-executive director with NHS Forth Valley and vice chair of this IJB. Good report, and obviously taking on board what we need to do in the primary care. But I think there's a really good level of assurance over the things that we control. In particular, I would mention the safe staffing legislation and the escalation process. I just wonder if you could say a little bit more about that. It's really gratifying to hear that we seem not to be breaching that, and that there's probably some good learning in there for other environments. Thank you.
Yeah, I can do Pat and Caroline if you want to come in for the social care part. So I suppose when we knew the legislation was coming, and we've put a lot of work in the legislation becoming effective and going live. So actually we've been running multi-agency groups for about a year, 18 months prior to the legislation going live. So actually we looked at the requirements within the Act and made sure that teams were comfortable with the requests in there, and put work in place to fill any gaps that maybe weren't being achieved before the legislation went live. What we discussed through the management group was those, in particular, those escalation pieces, and making sure that there was escalation plans in place should care not be safe on a particular day because of staffing levels, and we were given that assurance. What we have agreed moving forward as a management group is, instead of just having that fed through the subgroup reports, which we've now added on a specific agenda item onto the management group agenda as well. So there'll be a focused discussion moving forward at each management group level. The requirements in terms of health staff and care staff are different. So Caroline's been doing some work with some of the teams just to make sure that we've got an accurate way of fully recording the requirements from some of the care teams, which we want to get fed through the
Yeah, so just to add to that, Stephen, I guess, in terms of the change for social care for registered services, it was less of a marked change. It was just more about how you evidence demand and monitor it. The other thing that we had to consider is how do we consider it when we're commissioning services? And that was to ensure that whatever service we're commissioning meets the safe staffing standards. So it had to be written into the framework around when we're commissioning services. So that was the other thing that we did. So the short life working group that was looking at registered services for social care is disbanded, and it is now reporting up through the clinical care governance management group, and we would pick up any issues within that group.
No, thanks for that, and I think it's good that you've built that into the commission services going forward, or currently and going forward. So yeah, good stuff. Thanks.
Any other questions or comments? At least we have then considered and commented on it. Thank you. Move on to item 7, which is the Clinical Care Governance Committee report. And that would be Caroline.
So I was going to introduce it, and then Leona will cover her part, so I can see that she's joined. So this report summarises the recent inspection activity carried out by the Care Inspectorate in HIS, which is Health Improvement Scotland. I'll leave the prison section, Leona, to yourself to cover, and I'll cover the housing and care section. So that's a registered service that we have that provides a service to people, 120 people across 4 projects. It was a short notice announced inspection, and as a result of the inspection, areas of improvement were identified. The inspection considered 2 quality indicators and assessed the service using a 6-point scale, with 1 being unsatisfactory and 6 excellent. Finding in the inspections were very good for people, health and wellbeing benefits for care and support. And in terms of how good is our staff team, again, it was very good. In terms of the conclusions, we're asking that the committee vote and comment on the kind of output of the inspections. Leona, will I just pass over to yourself to cover the inspection into the prisons?
Yeah, sure. So for the inspection done by prisons, which is done by Her Majesty's Inspector Prison Services Scotland, and they bring along the Health Improvement Scotland partners. The overall rating that HMP Stirling got, which was just opened in June 2023, was a satisfactory rating, and there was 8 quality indicators were rated as good, 8 were rated as satisfactory, 1 was rated as generally acceptable, and it gave an overall rating of satisfactory. There were 16 examples of good practice and 8 recommendations for improvement. For the follow-on from this inspection, the board are then asked to submit an action plan 3 months after we got the full inspection report. So that's due on the 13th of November, and that is progressing well, looking at all the recommendations that were brought up, which are joint recommendations between Scottish Prison Service, the courts, GOAME and NHS Forth Valley Healthcare Team. And I don't know if anybody had any further questions they wanted to ask.
Well, I'd like to start by asking, it appears we have 2 separate inspection processes and 2 separate grading systems, which is a little confusing. So it's difficult to see what the comparisons are. I wonder, just for one thing, would it be possible to put into the report in the future just a clear list of the different gradings, so that, I know you said what they are, and as has Leona, but it would be nice if it was in the report saying what the 1 to 5 or 1 to 6. I'm fairly familiar with the care inspector, but I'm not so familiar with the prisons inspection.
Okay.
Sorry.
So if I may, I think it's important to say, and I don't have the data in front of me, obviously, because I wasn't prepared for that, but Forth Valley Prisons healthcare system performs very well in a national context, and I think it's significantly down to Leona's performance, as she's one of the best, most capable and experienced prison healthcare managers in the country. And I think that there's a relationship between the performance in Forth Valley Prisons and Leona's management. So I think that's fantastic. But I think you're right that it'd be important to understand all of that context in relation to national performance, etc. But I wanted to say that because I think they're one of those services that's not always very visible, but it's very large and very important. And those are our citizens, after all, that are in those prisons.
Thank you for that. I hope nobody thought that I was in any way being critical in asking for that clarification. But it's good to have that clarification.
Yeah, I was just going to say, so there are the 2 regulatory bodies, and Leona's looking embarrassed in terms of all the fun words. Very well deserved though. There are, so the care inspectorate monitors the care social care services, and this Health Improvement Scotland provides that monitoring for health services, but we'll provide that summary of what the actual grades mean in future reports. And I suppose, in terms of thinking about your question earlier around bringing in our newly integrated services, you'll see more of that coming through in terms of the health related services.
Yes, I mean, obviously this is a new reporting thing as well, but it's about getting it integrated in a way that makes sense, and not just to me being a bit slow and the uptake of these things, but also to the public in terms of what it means. That would be good. Any other questions or comments? Congratulations to Leona for that. Fantastic accolade you got there earlier.
Thanks very much, Tom. But I mean, he is right. We were quoted as the best healthcare services in Scotland. So thanks for reminding everybody about that.
Well, those things are worth saying.
Yes.
Saying out loud. So we have considered then and commented on the report, and that's that. So thank you very much.
Thank you.
We then come on to agenda item 8, Health and Social Care Partnership Complaints and Feedback Performance Report, April to June 2024. I think this will be you, Gordon.
It is indeed. Thank you, Chair. I think Ailey might be joining us. Hopefully she will be to speak to the health part of it. You got in your papers the report for the first quarter. I'm just opening it up just now. And I'm pleased to say that in terms of the timescales, that's table 1, we've seen a improvement from the poor performance there was in the last quarter of 23-24. Won't get too excited about that because it's still some way below what we were achieving in quarters 2 and 3 of 23-24. It's very much a case of long term trying to make sure that we sustain the improvements and build on them. What I did note and what I highlighted in the report from the first quarter of 24-25 was there's quite a significant increase in the number of complaints received. Pretty much as many complaints in the first quarter of 24-25 as there was in the last 6 months of 23-24. I had a look through the pattern of complaints that was coming through, and there doesn't seem to be a particular area that's generating, you know, concerns around that. We've seen a spike in one particular area, but obviously it's something we'll keep an eye on. One quarter is generally too small to think about trends. We did have a higher level of complaints pre-COVID, so this might be a return to kind of what was happening a few years back. But as I say, it's been a few years since we've had this level of complaint, so we'll keep an eye on that and try to look into the reasons behind that in a bit more detail for the next report. Moving through the complaints report to chart 1, the complaints outcomes, you'll notice over periods of time the number of complaints not upheld has reduced. The number of complaints resolved has been increasing, and there's also been an increase in the number of complaints partially upheld. This is part of a longer term attempt to change the way that we deal with complaints, which I think has been fairly successful, trying to adopt a less adversarial approach, trying to work with people with complaints to resolve those at an early stage, obviously, to learn from those complaints and to work with the complainant to try and understand better what their complaint is about and what parts of it we can address as an organisation. So just wanted to highlight that it's not a matter of concern that the proportion of complaints not upheld is falling. In a sense, they're all interrelated, and I think it's reflective of the approach that we've tried to take over the last few years to be a more an organisation that responds better to complaints. Looking through the table 3, as I mentioned a couple of moments ago, there hasn't been a particular spike in complaints in any area. The complaints overall are a pretty low level compared to the number of interactions that we have with individuals across Falkirk. And moving on from that down to section 5, just while I'm doing the talking, we've had some favourable feedback through care opinion and through individual services. Do say to the team managers to try and put the feedback, the positive feedback in, record it on customer first, but they're always telling me they're really busy and they would like to do more of that. But it's nice to see when we have those that positive feedback, and we try and make sure that staff hear about it and get to know about the positive feedback as well. Give a bit of a boost to morale. That's pretty much all I've got to say about the social care part of it. I believe that Ailey is on annual leave. I'm not able to speak in detail to her report, but I'm happy to take questions away to her and get some written feedback if there are particular questions around that. Thank you, Chair.
Okay, thank you. I think that the first thing that maybe needs saying is obviously the increase in the number of complaints needs to be kept an eye on, but I think it is always important to put it in the context of the number of interactions, because the number of complaints compared with the overall levels of activity is, the number of complaints is small, and I think that should be always highlighted in the reports, what it is as a proportion. But yes, we will look forward to hearing in future whether there is a trend or if it's just a one-off situation. Any other questions or comments? Ailey's part of the report.
Sorry, if there's a question there, it broke up. I didn't hear it.
There wasn't a question, no.
All right, okay.
I was just asking if there were any other questions
Right.
or comments. And if not, we will agree that we have considered and commented on the report. And we will move on to the next item on the agenda, which is item number 9, the Healthcare Acquired Infection Performance Report from April to June 2024. Now, who is coming forward? We are waiting for Jonathan, that's right. I was going to say that should be Jonathan, but I couldn't see him up there. So we'll just give him a minute to get signed in if he's aware of it is due. The other thing that Gordon was saying about this report that's important is that it's not just about complaints, it's also about comments and positive feedback. And I think I always say it, and I'll say it again, we must always be clear that complaints, there will always be complaints. It will happen because nobody's perfect. And we just have to make sure that we are learning from them and that we're drawing the lessons out of where things have gone wrong.
Francis Dodd speaking the other day in terms of every complaint that gets in terms of an opportunity for us to understand how we can improve and what we're dealing.
I think that's really important.
And context of what we do is people are often in quite stressed arrangements and their lives, and at a particularly pivotal moment, therefore things don't go exactly the way they feel it needs to. It can be difficult, but it's important to pay attention.
It is. It is.
Yeah, what you don't want is for people to have a problem and not complain about it if there's a problem. And there's too many people don't complain when there's a problem.
Yeah, it needs to be really easy for people.
Yeah.
Thank you very much. Okay, I see Jonathan has now joined us, so we will move on to agenda item 9, the Healthcare Acquired Infection Performance Report from April to June 2024. Welcome, Jonathan.
Okay, thank you, Chair. Afternoon, everyone. So this is the quarterly report for April to June. Just to give you some highlights of the report. For the care homes, work is still ongoing. We're still providing training and support to all care homes at the moment. Things are going very well with no concerns to raise. Outbreaks for this quarter seem to have fallen compared to previous quarters, bearing in mind that we are approaching winter soon. So we anticipate this to change in the coming weeks and months. Going forward, going over to our moving on to our surveillance, our Staph aureus bacteremias numbers have reduced this quarter for the and compared to the last quarter and for the same period last year. We thought it's important to include the previous year's data as well in our reports, because we do know that some of these infections are actually affected by seasonal variation. So we thought it'd be best to include what we saw this time last year as well. So overall, with our Staph aureus bacteremias, there are no concerns to raise, and there were no Staph aureus bacteremias reported in Falkirk or Bowness community hospitals. Device-associated bacteremia, similar picture to our Staph aureus bacteremias, numbers have fallen, and again, no concerns to raise with no device-associated bacteremias associated with Falkirk or Bowness community hospital, which is good. E. coli, again, similar again, numbers have fallen for this period, and again, nothing was being reported from Falkirk or Bowness. C. difficile remain low. Numbers haven't fallen dramatically, but as a point of reassurance, all these infections developed following antibiotic therapy rather than nosocomial route. So, people didn't acquire the infection through bacteria in the environment or within the hospital setting. So this is all to do with the bacteria being resident within the patient's gut and being the infection exacerbated through antibiotic therapy. Again, none reported through Falkirk or Bowness community hospitals. This report did include our AOP targets. Currently, we haven't got any AOP targets set. I don't predict them to be any. We are planning on having nationally interim targets set before the main targets be set in about 18 months' time. I believe we're not going to see any interim targets set until probably the end of the year or the start of next year. However, we're still monitoring them and we're still reporting them to the board and to yourselves and so on. So there's no change in terms of what we're actually doing in our activities across Forth Valley. Onto estates and cleaning scores. Falkirk's gone up a little bit, it's gone up by 1%, which is good. Just to highlight, the Bowness is now sitting in amber at the moment. This is an administrative error. I was discussing this fall with our estates colleagues or our domestics colleagues who actually perform these audits, and the percentage scoring and all the data that they input in a national database, and apparently some data was put in which was incorrect, and yet they couldn't be able to pull it out and to correct it. So it shouldn't be. It should be in the 90s as before, and it shouldn't be in amber. So I just thought I'd highlight that to you. We won't get the next report won't come out until December now, because it runs on a quarterly basis, or the end of December, maybe beginning of January now. So this will sit there in amber for then, and then hopefully things will be corrected, and with the new results coming through. And finally, on to outbreaks. There were no reported outbreaks at all for Bowness or Falkirk, which is good. Outbreaks at the moment are quite quiet across the whole hospital piece. COVID is still about, and there is a new variant that's just emerged, and it's in Europe at the moment. So I anticipate that coming across the waters and affecting us. But if it's anything like new variants that come up, we have little sporadic outbreaks that happen, and then it quickly dies down within about 3 or 4 weeks or something like that. So not overly worried about that, but it may make things a little bit more complicated because we're now entering into the new flu season as well. So not being a harbinger of doom and gloom, but we're preparing for the worst, at least, so we're anticipating an increase, but also then we've got the complexities of the new flu season approaching us as well. But other than that, all very well. And the report itself, I think, has been quite a quiet report, nothing of any concerns to report, but happy to take any questions.
Thank you, Jonathan. Can I ask you to, in the interest of clarity, explain the AOP targets?
Sorry, it's annual operating. These are the annual operational plans for health boards. So these are the targets. They go wider than just infection prevention control. They extend to all sorts of other key performance indicators across the boards, but these are specifically for IPC. So yeah, this is the thing that the boards is held accountable to, if you like.
Okay, thank you very much. Anyone else got any questions or comments? We see. Glad that there's not much to report on.
No, it's been a quite quiet quarter, which is good. Long may it last.
That is good news. Yes. So thank you very much, Jonathan.
Okay, thank you.
So we have considered and commented on the report. Okay, and we're on now to the final item on the agenda, item 10, the Clinical and Care Governance Committee, the Falkirk IGD Clinical and Care Governance Committee out of hours internal audit report. Who's going to pick that one up? Andrew. Right, thank you. Sorry, I had.
Good afternoon, Chair. Good afternoon, everybody. Thank you for the opportunity to come and to present this to you and talk to you, present this paper to you. As the paper outlines, earlier this year, the internal audit team conducted an internal audit into at the out of hours service, and now that the report has been finalised and submitted, the request was made to bring it to the committee for noting and for awareness with the committee. So I'm logically concluding the reports have been circulated and read, so I won't read the paper in its entirety, but just highlight the key findings from the report, and that are that the internal audit reports acknowledged and recorded the improvements made within the out-of-hours service to progress the actions noted in the improvement action plan. That the audit report noted 4 recommendations which have been made in relation to the out-of-hours service, and these findings were primarily addressed at Forth Valley to enhance governance, arrangements and awareness of key external reports. And the 4 recommendations are noted as there on the paper. Good progress is being made against these findings. 2 are already closed, they've been recommendation 1 and 3, and further work is planned to close remaining findings by the end of this year. So in summary, the internal audit provides a reasonable level of assurance for this report, and I'm happy to take questions and to answer any questions or queries. And I also know Vicky's now joined as well, so Vicky might want to add something in addition to what I've just outlined.
You want to add anything, Vicky? No.
No, I think that's covered. Yeah, thank you.
Have I had a copy of this report?
I think it came to pre-agenda.
The full report. Right, it's just. I don't recall seeing it at any point. But that doesn't, but necessarily mean I didn't get it. I am something, I get deluged by reports and I do sometimes miss things. So
certainly true. Yeah.
I'm not aware of having received that one. So, but I will take it as read that others have received and studied it and looked into it in some detail. So does anyone have any questions or comments to make? And the other question I have then is, will there be kind of continuing update reports in terms of out-of-hours service, or is that not going to happen?
So the intention is it'll come in through the Clinical and Care Governance Working Group, through the updates, through Nicola's update to this committee.
Okay, thank you. Anybody else got any comments? That case, we've noted the outcome of the internal audit and the reasonable level of assurance provided. So thank you very much, everyone, for
thank you
and activities. So thank you all, and have a good day for the rest of the day wherever you're going and whatever you're doing.
Thank you.
Thank you.